All right, here we go. Last unit. The last unit we are going to take a look at are medical diagnostics. Basically, how do we know what's wrong with you? That is the goal of what we're trying to learn. So really what we're trying to do is take a look at what are some of the tools, what are some of the methods that we use in order to actually diagnose a medical condition and then check it to make sure how things are going. So that's really ultimately what we're trying to do in this last little unit, is just really understand how do we know what's going on inside the human body and how do we actually treat those medical conditions. And to understand this, it's important that we actually understand what we mean when we say a disease. Now, one thing we would often do is we would actually call a disease a pathology. Path or pathos basically referred to like sickness or illness or disorder or something like that. And so pathology is the study of sicknesses and illnesses and things like that. So what we mean when we say a disease is we mean something where there is an abnormal function, or basically like something isn't working properly inside of your body. One way you can kind of think about this is think about the body in all those systems that we talked about as kind of like a vehicle, right? And if one part of that vehicle starts functioning abnormally, then essentially the whole thing is going to fall apart. Okay, so let's think about like a car for a second. You know, we're talking about a car, and on the inside of your car, you have your chamber, and then you got your piston. And basically this is where like the gasoline gets burned, turns into gas, it expands, pushes that piston down. But this piston has on it a little seal to make sure that it has a tight fit inside there, make sure no gas leaks around it, because if any gas leaked around it, then it wouldn't push down as efficiently. Now, let's say something happens and this seal cracks. Then all of a sudden you're going to have all these issues that are happening with your vehicle. So you end up taking it to the mechanic. And that's basically kind of what a physician is. A physician is a mechanic for the human body. They understand all the parts, how they fit together, the ways that they work, the functions they have, as well as the things that can go wrong. But in order to actually figure out what's going on, you know, you take your car to the mechanic, they actually have to diagnose. They actually have to figure out what's wrong before they can go in and fix it. They're not just going to open up your entire vehicle, strip every piece out, and look for the one that isn't working. They're going to use some different diagnostic tools and then figure out the appropriate treatment, right? And it's like when you go to the doctor, they don't cut you open from, you know, stem to stern and try and figure out what's going on the inside and what's not working. They use a set of diagnostic tools to actually figure it out. And so that's basically what we're looking at, is how do we go from knowing there's something wrong to actually figuring out exactly what that thing is and what do we do to move forward. Now, when we think about medicine, basically we use what's called Western medicine in Canada. And it's like kind of our mainstream healthcare system works off of Western medicine. And it is something that essentially uses the scientific method. And so what it means is we have a purpose. That's like the first thing we deal with, some kind of question. And basically in this case, it's like you have a patient who comes into the hospital and this patient is like, oh, I don't feel so good. You know, so they don't know what's going on, but they don't feel good. So then as a doctor or a healthcare professional, your next thing is to make a hypothesis based on the symptoms that you see, based on the knowledge that you have, based on what that patient is actually saying, and all of those clues, you kind of think about, okay, what could be some things that are going on? At this point, you are going to collect some data as a healthcare professional. So you might like break out your stethoscope. That's the thing that like has little ear holes and it's got the little thing on it. You listen to their heartbeat or their breathing or the sounds coming from their digestive tract or all those things. You might put them in an x-ray. You might get an MRI. You might get a CT scan, right? So there's lots of different methods that you can use to get data without just, opening up a human being to look inside. And so those are what you're going to use. You're going to start looking for some of the different things that you can collect data on to check and see, well, was my hypothesis actually correct? From there, you're going to get your data from your diagnostics and you're going to analyze it. So let's say you ran an x-ray. You're going to look at whatever it is. Maybe it's like their bones. That's their hand. If this is what their hand looks like, they get bigger problems. But, you're going to look and see, okay, what does that x-ray tell me? What kind of things are causing the symptoms that they have? Maybe they have an actual illness or something going on. And then you can draw a conclusion based on the data that you've collected. I should mention here, if in the analysis you still don't know, you're going to go back and collect more data. So let's say you went in and you got an x-ray, and that x-ray doesn't tell the doctor anything. They might then give you a CT scan, and then maybe that doesn't give you anything. So then maybe they do an MRI until they can start finding a cause. And once they find what seems like a probable reason for why you have the symptoms that you do, they draw a conclusion. So they decide, okay, this is what's going on. Here's how I can treat this issue. And here is how we can try and fix or mediate some of the problems that you're having. And then as a doctor, you need to actually communicate that, which is the last step of the scientific process. Always tell people what you've learned. So you have to talk to the patient. You have to talk to maybe like parents if it's a child, maybe caregivers if it's somebody who is unable to make medical decisions for themselves. And so this is kind of the steps you go through. Somebody comes in with something wrong. They tell you what's going on. You form a hypothesis, an idea about what that might be. You collect some data using diagnostics, and this is the focus of what we're going to look at in this unit. And then you analyze it. And we're also going to try and understand a little bit about what you can learn from some of those things. Now, we're not doctors, and we're not training to be. It's Health Science 20. So I don't expect you to be able to draw a conclusion. I don't expect you to be able to read an MRI and tell me if they have cancer. That's not reasonable. But this is what basically a doctor would be able to do. And then you have to communicate that to the people involved. Okay, so when we talk about diagnosis, a diagnosis is when we actually identify an illness. And here is my little plug. If you have Netflix, you should actually check out the show that is literally called Diagnosis. It's really interesting, and it's how they diagnose people. You'll actually learn how they do it. But they basically fit these into 3 different categories. So the people who make diagnoses would be clinical diagnosticians. And so these are the people who take a look basically at the patient's history. They examine the patient. This would be kind of like your doctor. This might be like a GP, a general practitioner, who is just looking to see what's going on, and they're going to use that to help them make a decision. Sometimes they might refer you to a pathologist. Remember, pathos is like disease. Ologist, one who studies. This is one who studies a disease. So they're actually going to look at things like your cells. They're going to look at tissues. They're going to collect samples of those things. And then they're going to see if they can figure out exactly what's going on. The other thing is you may have a radiologist who is involved. And so they are basically going to take pictures of the inside of your body and then use those to help them identify what's going on. So these are the people who are using x-rays and interpreting them. They might be looking at CT scans. They might be the people looking at MRIs or ultrasounds. That's kind of their job, is to look inside the human body. Now, one of the most important measures that we have are what are called the vital signs. And so vital signs are essentially the measurements you make to get immediate feedback about health. So this is like immediate life and death info. And our 4 vitals that we consider there to be are the body temperature, often abbreviated your BT, your blood pressure, abbreviated your BP, your heart rate, your HR, and your respiratory rate, your RR. If you think about what each of these are, remember we learned that without a normal body temperature, proteins in your body unfold and you die. Without a normal blood pressure, then something's going on with your cardiovascular system. Without a normal heart rate, oxygen is not flowing to your cells or your brain, and it's not delivering CO2 away from your cells, right? And so that if your heart rate is too low, it's not pumping blood, you're not getting enough nutrients, you're not delivering enough waste, that is a really bad sign too. And if you're not breathing enough, you're not getting enough oxygen, you're not getting rid of enough CO2. These are all things where if something is not normal, then you might be dying. These are also the things, if you go and get like sent to the hospital, they have a big monitor and it's like, got the little measures like this on it. Hopefully it doesn't look like that. If it does, then you should probably, you're in trouble. But it'll have this. So this would be like your heart rate. It'll also measure your blood pressure. So you'd have like your BP. It'll measure your temperature. So it'll be like 37 degrees. And then it'll also measure your respiratory rate. Those monitors that you see people hooked up to, they're measuring their vitals because they're so important to find out the immediate health of a patient that we need to monitor them pretty constantly. These are also the things that like a paramedic would check immediately upon arrival. They're going to start looking for all of these things. So when it comes to your body temperature should be 37 degrees Celsius. Now it kind of fluctuates a tiny, tiny little bit. And actually women tend to have a slightly lower body temperature, whereas men tend to have a slightly higher body temperature, but it needs to be in this range. If it is too high, it means you have a fever, and a fever is part of your immune response. It's actually your body fighting a disease. If it is too low, that's also not good. Too low, then you can also die. It's hypothermia. So remember, this is all due to enzymes. Enzymes carry out the functions or the chemical reactions inside your body. You're just a big walking bag of chemicals. So without those enzymes to carry out those chemical reactions, if they stop working, then your cells will not work efficiently. And if your cells don't work efficiently, then you don't work efficiently and you can die. Okay, your body temperature. Your body temperature needs to be pretty constant. If it doesn't, you die. And if you have a high temperature, basically it's 38 degrees Celsius or higher, you are suffering from a condition called hyperthermia. Hyper means above or over. Thermia or therm means temperature. Temperature. And so it basically means you have gone over a safe temperature. Hypothermia comes from a lot of different things. It could actually be from a fever. A fever, remember, is your immune response. Basically, it means that your body is using a last-ditch effort to try and stop an invader from in your body. So it's trying to basically burn it up, and it's trying to increase the rate of white blood cell production. That's really why you have a fever, so that you can get more white blood cells and to kill pathogens. Most people think that the pathogen causes the fever, but it's actually the body. The body turns on the fever to try and kill it. Heat stroke is actually the most common cause of hyperthermia, though, and not fever. And heat stroke is basically you are out in the sun too much, and it can cause you to get too hot, And if you get too hot, your proteins unfold and you die. And so if you're out in the sun for too much, you're out in the garden, you're in the garden, you're picking weeds. This is my weed here. And you have a head, you're not wearing your hat, sun's beating down on you, and you get way too hot, start sweating too much. This is going to lead to you essentially getting heat stroke. If you start to feel like you're nauseous or you're really, really tired and those kinds of things, after you've been spending lots of time in the sun, that's a good sign that you have heat stroke. You can also get hyperthermia from dehydration and drinking too much alcohol or doing too many drugs, or from just physically exerting yourself too much. So this is like one of the big problems when people take a trip to Mexico. They basically sit on the beach all day, they're drinking their margaritas all the time, and they're not drinking any water, and it's really, really hot out and they get heat stroke, but it can actually be severe enough that they get hyperthermia, and in really severe cases can die. So drink a glass of water, get out of the sun for a while. Okay, hypothermia. So if you get hypothermia, then hypo means below. Thermia, remember, or therm means temperature. And so if you have a temperature below 35 degrees, you have what is called hypothermia. It is almost always caused because you're in the cold for too long, and that will cause this to happen. So what really happens here is your body goes into a response due to the fact that you are cold. So we have our human body here. If you think about all of the important parts of your human body that you need to survive, they are right here in the center. They are things like your heart, your lungs, these are your lungs, your brain, so you got your brain up here, your brain stem. Okay, without those things, you die. You can live without feet. So what happens is your body turns off, basically like contracts blood vessels in the outer parts of your body. The reason it does this is, so remember, your blood also carries heat. So as your blood is flowing outwards from the center of your body, it will actually lose heat to the outside world, which then means when it cycles back into the center of the body, if the blood is colder, then the internal body starts to get colder. So by shutting off basically like shutting off the blood flow to the extremities, it's able to retain the heat by having less blood flow and less heat loss. But what's going to happen then is it's going to increase your heart rate to try and basically like continue cycling heat through all of the center parts of your body. If it gets too cold, then it means that your brain cells are going to start getting too cold and your neurons aren't going to work properly. Your body starts shivering because if you start shaking, it actually starts generating heat by using muscles. So, you start shaking around, that's you shaking. And basically what that's going to do is try and make more heat so that you can stay warm by increasing the use of your muscles. If those things don't work, you can actually die of hypothermia. And severe hypothermia can actually lead to a really strange condition called paradoxical undressing, where people actually start getting undressed and removing their clothing even though they're freezing to death. This is because your brain is not functioning properly, and so it basically loses sense of what is rational at this point, and it just starts doing things. And so this is just one of those things that is a side product of your brain cells starting to get too cold. Okay, your blood pressure. High blood pressure is one of the leading pathologies in the world, especially in Canada and the United States. But basically, if you think about your blood flowing through your vessels, when your heart pumps your blood pushes against the outside walls of your blood vessels. And then when your heart is not beating, it does rest, but it still pushes against it slightly. When your heart is beating and the ventricles are contracting, this is the maximum force placed on the outer parts of your blood vessels. This is called your systolic pressure. The blood flow, or the blood pressure, how much your blood is pushing against your veins and arteries without the ventricles contracting, is called your diastolic pressure. And so diastolic pressure is basically when your blood is at rest. One of the leading causes of this is getting too much salt in your diet. So if you get too much salt in your diet, what happens is your blood hangs on to extra water. And so it's kind of like overfilling a balloon, and you end up getting this increased pressure against the walls of your veins and arteries. Commonly high blood pressure, just like blood pressure that is too high, is called hypertension. Hyper, high, tension, force against something. And so too much force is being put on the outer walls of your blood vessels. If this happens too frequently, it can actually weaken areas in your blood vessels, and then they can burst through. That is called an aneurysm. I probably spelt that totally wrong. I don't know how to spell aneurysm, but that's what an aneurysm is the weakened walls of the blood vessel. Low blood pressure is called hypotension, and basically it means you're not getting enough blood flow out to certain parts of the body. And so the blood is not putting enough pressure against the outside walls of your blood, which means it's not being pushed hard enough. So it's important to understand what pressure is to understand how blood pressure actually affects you. Basically, pressure comes from particles hitting against the walls of their container. And so for us, our blood pressure is the actual blood exerting force against the walls of our blood vessels. That's what blood pressure actually is. Blood pressure is affected, or just pressure is affected by a lot of things. If we were to have a smaller container and the same amount of stuff in it, then the pressure would actually be much higher. You know, if you take, let's say you take a whole bunch of gas in a balloon and then you tried to shrink the balloon with the same amount of gas, well, you're going to increase the pressure of that gas. Okay, so blood pressure is essentially when, like high blood pressure is essentially when your blood is pushing too hard against the sides of the arteries. And this can happen for a lot of reasons. But if you think about like your systolic pressure, when your heart contracts, if you have a really, really high systolic pressure, now just so you know, with blood pressure, we always list it systolic over diastolic. So this is heart beating, and then the bottom one is your heart resting. If you have a really, really high systolic pressure, it could mean that your heart is beating really, really hard. It could also mean that you have a buildup of plaque on the inside of your blood vessels. And so then as the blood is trying to flow through the vessels, it's basically being forced into a narrow area, and that increases the amount of force that it pushes against the sides of your walls with. So this is a condition called arterial sclerosis. And it's basically like the leading cause of heart attack, essentially, is having narrowed arteries due to the buildup of plaque. A lot of that is from high cholesterol in your diet. And low activity, low exercise as well. If it is in reverse, where basically you have pressures that are too low, it means your heart's not beating strong enough. And it can lead to things like you fainting regularly, or just feeling kind of nauseous and those kinds of things. They can all lead to or they can all be caused by low blood pressure. All right, your heart rate. Your heart rate is how fast your heart beats. And hopefully we understand. If your heart isn't beating fast enough, you're going to die. If your heart beats too fast, you could die. Basically, you need your heart to beat the right amount. And your heart is able to adjust to what it needs to. Cardia refers to your heart. And if you are tachycardic or have tachycardia, tachy means high. And so it means you have like a high heart rate. Your heart is beating too fast. Cardia, again, means heart, but brachy or brachy means low. And so it means like a low heart rate if you're brachycardic or brachycardic or have brachycardia. It is possible that this can just be a short-term thing, or it can actually be a chronic thing where you have like long-term, your heart just beats too fast. The most important thing though, well, aside from how fast it is beating, is actually the rhythm of the beat. So you need it to basically beat regularly. If it does not beat regularly, then that is a really bad sign. So if your heart like goes through really weird cycles and like beats too fast, these are what we would call an arrhythmia or a dysrhythmia. Basically, it is out of rhythm is what that means. Dys means not. Rhythm refers to rhythm, basically like the timing. And so it is not in time. And if you have dysrhythmias, it can actually affect how blood is circulating through your body. So that can affect a lot of things about your body. The other thing that we need to know is your pulse volume. This is basically exactly what it sounds like. It is how loud your heart beats. And it refers to the strength of your heartbeat. If you have a low pulse volume, basically it means that your body is pumping blood too weakly. If you have a high pulse volume, it's pumping blood very strongly. And it can be an indication of things like high blood pressure, or maybe it means your heart is working too hard, but this is another thing that we take a look at. The other thing we look at is a bilateral presence. Bi means two, lateral means sides. What we want to look at is blood flowing at the same strength on both your left side and your right side? Because maybe you have a blockage in an artery that's flowing to, let's say, like the left side of your body. And that means that you're going to have less blood flow, so lower blood pulse volume. So there's lots of things that you can look for, not just the heartbeat, but how it's actually distributed throughout the body. All right, your respiratory rate. Your respiratory rate is how fast you breathe when you're not really thinking about breathing. And so it changes throughout the course of your life. You can see that your breath basically slows throughout the course of your life. And the reason why is because your metabolism slows down. Basically, how much energy is used in your cells decreases over the course of your lifetime. So you don't need to breathe as much because you don't need as much oxygen, so you don't output as much carbon dioxide. Your respiratory rate isn't always helpful because it doesn't necessarily tell us how much oxygen is getting into your blood. It just tells us how much you're breathing. And so you can be breathing just fine, but still have things going on inside your body that maybe aren't necessarily working properly. But if your respiratory rate drops or sharply increases, this is a huge sign that there is an immediate problem going on, and so an indicator that you need to do more, which is why this is one of the vital signs. Hyperventilation, you're breathing too fast. It can be due to lots of reasons. It could be exercise, anxiety, body temperature, all these things. But if you start breathing too fast, that's one indication that something is going on inside your body. Hypoventilation means you're breathing too slowly. Slow, or below, I should say. You are breathing below the amount that you need to. So basically, it might be that you have medications or things that are changing the way that your body works. Maybe it's blood pressure, maybe you're not getting enough oxygen. All these things could be affecting it, but again, breathing too slowly is a huge problem. And again, there is what is called your rhythm of respiration. So how well you actually are breathing. So what is the timing of your breaths? And if you have abnormally shallow breaths, and then they eventually like increase and become deeper breaths and then become shallow breaths and repeat this over and over again, this is what are called kind strokes. Basically, it's an abnormal way of breathing. The other thing we need to think about is how well you are actually breathing. How much air is actually flowing into your lungs. So if you got your lungs here, how much oxygen is actually flowing into your lungs? So are you breathing enough? If you have dyspnea, dys means not. PNEA refers to breathing or to lungs. It's like pneumonia or dyspnea. Those all refer to how well you're actually breathing and getting air into your lungs. Now, there are some other vitals that people may take a look at because there's other things that they need to find out about. So they need to look at pupillary action and eye movement. This tells them about brain function. They may ask you about your pain. This could tell you all sorts of things, basically. Your menstrual cycle could help them understand the flow of hormones in the body and understand what's happening there. Oxygen saturation could help you look at how well the alveoli or how well the cardiovascular system is working. And blood glucose levels tell you things like diabetes. They could tell you about metabolism. They could tell you all sorts of things. So those are other common vitals that people take. Pain is one of the most common, and what they'll do is ask you to rank your pain on a scale from 1 to 10. Keeping in mind, every person feels pain a little bit differently, but they'll also tend to ask you what kind of pain you have because that can indicate different things. So it's important to try and think about those things if you go to the doctor. How much pain am I in? What kind of pain am I feeling? Okay, so if we think about something like this, we have a male patient, they come to the doctor, they're overweight, they're 57 years old, and these are their vitals. So if their blood or their body temperature is 37, that's good, that is where it needs to be. Their blood pressure, okay, systolic is high. Their diastolic is still, is fairly normal. It's like within a decent range. Their resting heart rate is 110. This is high. The average resting heart rate should be somewhere around like 60 to 70. That's still like 70s on the high end. 60 is pretty good. The lower your resting heart rate, the healthier you are thought to be. And their respiratory rate is still a little bit high. So if you start thinking about what are some other diagnostics I want to do, well, immediately I'm thinking, based on the blood pressure, there is something going on with their cardiovascular system. Their heart is racing. They are breathing a little bit heavily. Maybe I want to find out a little bit more immediately about their heart. So you're going to need to do some diagnostics to check their heart. You probably want to check their blood to find out if there's something going on inside their blood. There's all sorts of things that you could be going on. I mean, based on the other information I know about the patient, they're a little bit older, they're overweight, high blood pressure, high heart rate. My immediate worry, based on what we know, would be some sort of heart condition. And so we could be looking at heart attack, we could be looking at hypertension, we could be looking at anxiety, we could be looking at all sorts of things that could be happening. But you can see just a few pieces of information can give you a quick look at what's going inside of their body. So those are vitals. That's what they are. See you next time as we take a look at chemical diagnostics.